The methods for making a humeral cuff and for utilizing the hinge are the same as those demonstrated previously. If the range of motion stops are removed, full elbow flexion and extension are possible while the forearm is held in supination. The third splint design is similar. It also controls forearm rotation. An ulnar gutter splint is used with the hinge and a humeral cuff. 2 hinges are used for additional stability. The pattern for the ulnar gutter wrist splint follows the thenar crease and the distal flexion crease. At the dorsum of the hand, the splint will extend from just proximal to the MP joints to cover approximately 2/3 of the forearm. The pattern is cut and placed on the arm so that it can be modified as necessary. The pattern is traced onto the thermoplastic using a wax pencil. The thermoplastic is softened by heating for a brief time and the pattern is cut out. 1/8 inch thermoplastic may be used because this is not a circumferential splint. Again, the hand is covered with tube stockinette and adhesive back foam is placed over the distal ulna. The thermoplastic is heated, dried, then draped over the ulnar border of the hand and forearm. Care is taken to roll the edge proximal to the distal flexion crease and to clear the thenar crease. The splint is gently held to conform to the distal transverse arch of the hand. As the thermoplastic cools, adhesive-backed Velcro is attached and Velcro straps are added. Soft strap material is used for comfort. This is particularly important at the thumb web space and over the radial aspect of the wrist. The location of the first hinge is marked. After the humeral cuff and the first hinge are in place, a second hinge is added. Stops are adjusted as indicated. Stress tests done on the hinge have shown that it does not bend and that the ball bearing joint does not bind when weights up to 25 pounds have been suspended at a right angle. However, if the splint is to endure heavy use, it is advisable to use 2 hinges, one medial and one lateral, for increased stability of the splint. Each of these splints is lightweight, 6 ounces or less. The hinge itself weighs less than 2 ounces. That's important for the patient's comfort. The 3 examples of splint designs incorporating the hinge illustrate that it is an efficient component. It simplifies splint construction and modification, and it serves a variety of splinting needs.